Welcome to this channel. Today is Tuesday the 9th of July 2024. The theme of this video is the effect of physical exercise on insulin resistance. Various approaches to address this health concern are documented, amongst which increased the habitual physical activity has been shown to be beneficial, showing improvement of cellular insulin sensitivity. The interplay between insulin sensitivity and insulin resistance plays a key role in development and persistence of the diabetic state, which can be directly linked to the levels of physical activity. Through reduction of central obesity, regulation of adiponectin and leptin levels are also linked to physical activity. Many studies have emphasized the importance of physical exercise in preventing type 2 diabetes. Physical activity, along with diet change, inhibit or at least postpone the progression of impaired glucose tolerance to overt type 2 diabetes. A meta-analysis of 14 studies showed a clinically significant reduction in glycosylated hemoglobin in response to exercise in type 2 diabetic population. In type 1 diabetes, physical exercise restores insulin sensitivity, thus affords better glycemic control. In fact, there were evidence that risk of developing diabetes can be lowered by moderate aerobic exercise. In existing diabetics, regular physical exercise combined with diet modifications demonstrate reduction in body mass index (BMI), increased high-density lipoprotein (HDL) levels, decreased triglyceride (TGL) levels, and normalized blood pressure. Habitual physical activity also reduces all-cause mortality by reducing the risk of coronary heart disease, stroke, and colon cancer. Then how physical exercise would affect insulin resistance? Type 2 diabetes is characterized by a symptom of insulin resistance, but it can exist in type 1 diabetes as well. Insulin resistance means the inability of a known quantity of exogenous or endogenous insulin to increase glucose uptake and utilization in an individual as much as it does in a normal population. However, science has yet to tell the exact molecular action leads to insulin resistance. Several mechanisms have been proposed to be the underlying cause of insulin resistance. These include, first, genetic abnormalities of proteins involved in insulin action cascade. Second, fetal malnutrition. Third and final, high visceral adiposity. For most patients, insulin resistance occurs as part of a cluster of cardiovascular and metabolic abnormalities, commonly referred to as the metabolic syndrome, which may contribute to the development of type 2 diabetes. It has well been proven that serious and acute physical exercise is connected with substantial improvement in insulin sensitivity. For example, a single bout of moderate intensity exercise can increase the glucose uptake by at least 40%. Studies also observed significant improvements in glucose tolerance and insulin sensitivity in response to exercise training obtained post-training measurements within 12 to 48 hours of the last exercise session. This is neatly supported by the fact that cessation of exercise in trained persons is connected with a marked and rapid decrease in insulin sensitivity. Perseheim, G. demonstrated that a single bout of moderate intensity exercise could increase glucose uptake by at least 40%. In addition, exercise promotes weight loss, which reverses the insulin resistance being a common characteristic of obesity. In association with diminished body fat, the beneficial impact of daily exercise on insulin resistance could be magnified. Indeed, combined with the fact that modest exercise reduces the morbidity and mortality connected with diabetes and cardiovascular disease, it is an effective therapeutic strategy for reducing insulin resistance and, more importantly, in the broader sense, improving overall quality of life and well-being. Habitual physical exercise can help individuals reverse diabetes due to insulin, as excess adiposity in the waistline contributes to insulin resistance. Regular exercise assists in reduction of body fat, thus increasing cellular insulin sensitivity. Glucose uptake remains elevated for up to 120 minutes after physical activity because of increase in glucose transporter type 4 presence in plasma membranes and T tubules. Insulin sensitivity increases for at least 16 hours post-exercise. This is observed in both healthy individuals and patients with type 2 diabetes. Physical training may also make favorable changes in lipid metabolism and regulate hepatic glucose output, which is important in the type 2 diabetes. Thank you for watching and listening. Goodbye.